It happened so fast. 1 minute Cheryl was her usual self. And then...
Cheryl! Cheryl!
I've never been so afraid or felt so helpless.
Call 911!
I didn't know what to do. Fortunately, I didn't have to.
Christiana, we're routine with a 58-year-old female who will be to you in 10 minutes requesting a stroke alert.
Christiana Care was there for us.
Copy that. This is DFES 999. We'll call a stroke alert. We'll meet you in room B as in boy in 10 minutes.
This is Cheryl Johnson. She had a sudden onset of right-sided.
When we got to the hospital, they were already waiting. They didn't know Cheryl,
Keep it up, keep it up.
but they knew how to help her.
On the right, so it looks like we have global aphasia and a right hemiplegia. Is there anything else we need to do before we go to CAT scan?
No, I think we're good.
They knew how to help all of us.
Okay, I think she's having a stroke. There's some medicine we can use because she got here right away to try and open up that blockage, okay? We're taking her over to the CAT scan so we can get a picture of her brain, and that'll tell us different kinds of stroke. There's a bleeding type and a blockage type. I'm gonna let our team know everything about what happened. We'll be back to update you.
We can get the best images we can.
It was like their team had been practicing for just this moment, when our family really needed them.
Yes.
Doctors, nurses, others I'll never know. I saw excellence. Excellence in every way.
We're gonna give you some medicine here.
Let your husband and your daughter know what's going on.
All I know is that every step of the way, I never felt alone. They made us feel safe. They made us feel loved.
At Christiana Care, our mission is simple yet profound. We take care of people in our communities, in our hospitals, and at our practices. We serve our neighbors as respectful, expert caring partners in their health. We serve together, guided by our values of excellence and love.
One of the main reasons that I became a volunteer was because of the wonderful care.
I was treated with respect. I loved the way that they just made sure that I understood everything and checked with me about all parts of his care.
Their skills were exemplary, but what really impressed me was their care and compassion for my husband.
Excellence is just, bar none, is Christiana.
We share our commitment to excellence at Christiana Care. Whether we care for patients or support our colleagues in that care, we're all working toward the same goal, to be at 100% in every interaction.
Excellence represents an unrelenting desire to develop the best healthcare system in the world.
We really want to do what we do every day better. We want to build on what we've done. We want to take care of the people that are in front of us and constantly be reevaluating how can we do that better each day.
It's about the process, it's about the experience, and it's about this much actually being self-aware that you are delivering excellence and you're delivering that experience for people.
We all want to make a difference, and the stakes don't get any higher. The work that we do every day affects the lives of our neighbors, and we know that no matter how good we are today, there's a way to do better.
The work that we do is hard. It takes intense training, study, and practice, learning to work together as a team in a fast-paced environment where life and death are often on the line. It takes resilience. It takes courage.
You're doing a great job, Cheryl. We got that artery open.
I had a conversation recently with a patient sitting in a waiting area. And I said, what do you like about coming to this practice? And she says, when I come here, I feel loved. It's something different, she said. It's a different feeling. It touches me more deeply, and it's a special connection.
When faced with the question, what is love in healthcare, I say, what is healthcare without it? It's not romantic love or the love that you feel for your family. Love in this sense is a deep appreciation of the value and importance of another person, the knowledge that my well-being and your well-being are interconnected. And when I make that connection, I know I'm at my best. I'm approaching the people I serve with respect, compassion, kindness, and a focus to do everything I can to help.
Lillian Wald, the founder of Public Health Nursing, said that nursing is love in action. I think that's such a beautiful expression of what it means to be a nurse. And I see it demonstrated every day by the extraordinary nurses of Christiana Care. I hear it time and time again from our patients. I felt safe. I felt cared for. I felt loved.
Recently, we received a letter and the wife of the patient had brought her husband into the emergency room after having a seizure. She shared how patient escort talked to him while he went through his tests and transferred to his rooms and took his mind off of things and treated him like he was a patient, not just a room number. From A to Z, she highlighted everyone that touched that patient. And I think what touched me the most was that it's those seemingly inconsequential things to you that are huge to them that they will never forget because they feel like they are cared for. That is excellence, and that is serving with love. And I'll never forget the way it made me feel, that pride, that our team took care of him the way that they did. It's a really good feeling.
If there's one thing we can count on in the healthcare industry in the United States today, it's change. As we look to deliver better health and a better experience of care at lower costs, we're transforming the entire healthcare system. We're innovating and experimenting, and in many ways, we're moving faster than we've ever moved before.
We've been serving the people of Delaware for more than 100 years. But there's a new energy at Christiana Care, a feeling that we've just begun to realize our potential.
When you look across industries at organizations that thrive through periods of great change, there's one thing they all have in common. They understand and are guided by strong core values. In defining our core values at Christiana Care, we worked in ways that we've never worked before. We engaged our entire organization in a conversation about our values and behaviors that will enable us to deliver optimal health, exceptional experience, and organizational vitality to our patients, our community, and each other.
We commit to being exceptional today and even better tomorrow.
We seek new knowledge, ask for feedback, and are open to change.
We use resources wisely and effectively.
We are curious and continuously look for ways to innovate.
We are true to our word and follow through on our commitments.
We anticipate the needs of others and help with compassion and generosity.
We embrace diversity and show respect for everyone.
We listen actively, seek to understand, and assume good intentions.
We tell the truth with courage and empathy.
We accept responsibility for our attitudes and actions.
We serve together, guided by our values of excellence and love. Through these actions, we deliver on the promise of the Christiana Care Way.
We are actively moving from a health system to a system that impacts health. We can be the catalyst for a healthier community. Together. The work we do is in many ways incredibly complex, but in other ways it's this simple. Every interaction has the potential to make an impact.
We really felt loved here.
Good luck with everything.
Thank you, thank you.
And none of us can do it alone. We serve together. It takes a team, an extraordinary team, guided by the values that are fundamental to the best healthcare: excellence, love. These values guide us in our interactions with our patients and our community. These values also guide us in our interactions with each other. We know that when we practice with love, we create exceptional outcomes.
They're here!
Love drives quality, safety, and excellence. Our exceptional today is tomorrow's baseline. We're always looking up at that next step. And whether that's a little step forward or a giant leap, that improvement is going to make a difference, a big difference in another person's life.
I'm home, Grandma. Thank you. There's no place I'd rather be.
Hello?
Good morning. It's Brenda from Care Now.
Hi, Brenda.
How are you?
I'm doing great.